To this, as the number of people infected with the COVID-19 continues to rise, some members of the public are warning that COVID-19 is a serious disease that can kill the infected person. In an interview my colleague Divin UWAYO had with BIZIMANA Jeffer, he began explaining how he felt after contracting the disease and how he was eventually taken to a hospital as he couldn't breathe properly.
I don't
know how I contracted it. At the beginning, my back was paining, and after 3 days, my temperature rose to 39 degrees Celsius. I could take tablets, but the temperature couldn't reduce. After 2 to 3 days, I called the doctor. They tested me, and I was positive. After 4 days, I had a terrible cough. I could take medicine, but it couldn't heal. On the 6th and 7th day, I felt so weak, and I couldn't breathe well. I called for an ambulance, and I went to the hospital. I first went to Kichukiro, and eventually to Kanyinya, where they put me on a life support, and they injected me with medicine. I started recovering, but I was still weak. It felt like something was consuming my body. The medicine helped me, but doctors as well took good care of us. I spent 3 weeks on a life support. On the 4th week, they transferred me to another room to wait for other results.
BIZIMANA
Jeffer, who is a businessman, warns people who perpetrate the pandemic and urges them not to give up on the preventive guidelines.
Thank you for visiting me. I felt that giving this message was very important. Maybe people who deny this virus don't know what is happening in the US and other countries where 10,000 people die of the disease in one day. It's a very dangerous disease. It's not flu. It starts with some symptoms of flu, but after 7 days, it starts consuming your body. People should prevent themselves wearing masks and washing their hands. They should restrain from unnecessary movements. Looking at me as a trader, you can't go to work when you are sick. Even the country's economy goes down. If you could go to Kanyinya and see how much the country has invested in treatment centers, it's a lot. So we should prevent ourselves by wearing masks and washing our hands. It's very simple. It's just a personal decision to make.
Kwirinda biroroshye ni ubushake bwa buri muntu.